So today we will discuss the histology of large intestine and appendix. Small intestine is done. Okay, you have seen slides of duodenum, jejunum and ileum. Okay. Ileum you have not seen? Oh, only ileum is slide. So large intestine, it consists of cecum, vermiform appendix, colon. Colons are ascending colon, transverse colon, descending colon and sigmoid colon, and rectum and anal canal. All these parts are together forming the large intestine. Okay. And gross anatomically, large intestine shows three cardinal features. These are asked in your viva. What are the features of the large intestine? You will see also viscera of large intestine. Okay, so these features are also important for your histology and also for the viscera. So they have Tenia Coli. Tenia Coli is the accumulation of the longitudinal muscle layers at three places. Three tenias are there. Okay, and there are Haustrations. Because of presence of this Tenia Coli, length of this Tenia Coli is less than the length of the gut. That's why there will be formation of saccules, and that is known as Haustrations. Next is Appendices Epiploicae. These are sacs filled with fat, peritoneal sacs filled with fat. Okay. This lies in between the two Tenia Coli. A single layer of Appendices Epiploicae is there. So this is also known as omental appendices. Okay. Omentum is part of the peritoneum. So see here. This part, this distended part is the cecum. This lies in the right iliac fossa. And from here, this small extension is the appendix. Here, ileum is joining with the cecum. This is ascending colon, right colic flexure, transverse colon, left colic flexure, descending colon, sigmoid colon, rectum and anal canal. Okay, so all these are parts of the large intestine. And these are the tenia. This length of tenia, one tenia is visible. They are located on three sides of the gut. Okay, and all are converging near the base of the appendix. So and these fatty extensions, you can see these are the appendices epiploicae. Okay, so you can see the length of tenia is less than the length of the gut. Okay, so that's why there is formation of these saccules. These saccules are known as sacculation or Haustrations. Okay, so these are the three important features of large gut: presence of this tenia, sacculations, and thus Appendices Epiploicae. These are not present in the small intestine or other parts of the GIT. So these are the histological picture of the large gut. So there is location of simple tubular glands in the lamina propria of the large intestine. So these are the simple tubular glands. Okay, here is the opening of the crypts. Epithelium, mucosa formed by three layers: epithelium, lamina propria and muscularis mucosa, and beneath it is the submucosa, and within the lamina propria embedded this simple tubular glands, crypts of Liverpool. Okay. Next we are going to colon. Colon, a section of colon shows four layers: mucosa, submucosa, muscularis externa and the serosa. Okay, mucosa consists of three layers: lining epithelium, lamina propria and muscularis mucosa. Lining epithelium is simple columnar epithelium and a number of goblet cells. And the epithelial cells show microvilli or striated border on the absorptive cells. Okay, so there is lining epithelium. Lining epithelium is simple columnar epithelium and a number of goblet cells are present in the epithelium. And the epithelial cells show microvilli or striated border on the absorptive cells. In large intestine, the plica circularis, circular folds you have seen in the small intestine. Okay, and villi are also features of small intestine. These are absent in the large intestine. This is also a identification feature, differentiating point from the small intestine. Hence, the mucosa of large intestine has smooth surface, okay, because of absence of villi and folds, absence of folds. Next, glands are present here. Lamina propria is occupied by short, simple tubular intestinal glands or crypts of Leiberkund. And these glands are lined by simple columnar cells and many goblet cells. This is very important. Okay, many goblet cells, numerous goblet cells that will give a foamy appearance, okay, of this epithelium. Every alternate cell will be goblet cells here. Okay, so surface epithelial cells and goblet cells have a lifespan of 5 to 6 days. So lifespan of enteroendocrine cell is 4 weeks. These are also present, and large intestine performs absorption of water and electrolytes and production of mucin that lubricates its contents. Okay, and lamina propria shows collagen table, thick collagen fibers between the basal lamina and epithelium. Collagen table regulates the transport of water and electrolytes. According to new concept, there is pericryptal fibroblast sheath in the lamina propria of the colon, and these fibroblasts replicate and migrate towards the luminal surface and may differentiate to form the macrophages. Lamina propria shows discrete lymphatic nodules that are regularly spaced. According to new concept, lamina propria of the large intestine show presence of occasional lymphatics, and according to previous concept, large intestine do not have lymphatics in the lamina propria. Okay. Next, we are going to discuss the epithelium mucosa, mainly 3 layers of the mucosa. Next, we are going to submucosa. Submucosa consists of dense irregular connective tissue. Okay. And Muscularis Externa, it consists of thin inner circular and outer longitudinal smooth muscle fibers. The longitudinal fibers form 3 thick bundles as Tenia Coli, even visible on gross examination. Due to the shorter length of Tenia Coli than the other layers, the large intestine shows sacculations. Okay, we have already said Tenia Coli length is lesser than the gut length. And Serosa have pockets of fat called Appendices epiploicae. Serosa mainly layer of peritoneum covering the gut. Not all the sides of the large intestine is covered with peritoneum. Some parts are retroperitoneal also. Okay. So these peritoneal pockets of fat are known as Appendices epiploicae. See, like this, it will look like, see, all those white areas are goblet cells. Okay, so it is lined by simple columnar epithelium with goblet cells. These are the lamina propria, loose connective tissue with sections of blood vessels. Here are the muscularis mucosa, inner circular, outer longitudinal layer. Here, this is longitudinal, this is circular, and some lymphatic nodules you will also see. And this part is the submucosa. Here is the submucosa. Here also some adipose tissue, sections of blood vessels you will see. And these are the muscle layer, inner circular layer, outer longitudinal layer. And here longitudinal layer is thickened to form the Tenia Coli. Okay, understood? So like this you will see. So histology of colon, mucosa is lined by simple columnar epithelium with numerous goblet cells. Simple tubular glands are present. Lamina propria shows discrete lymphatic follicles, and there is muscularis mucosa. Okay, so lining epithelium, lamina propria and muscularis mucosa together forming the mucosa. Next we are going to submucosa. It is formed by the connective tissue, and no Brunner's glands and Peyer's patches are present. Brunner's glands are features of duodenum, Peyer's patches are features of the ileum. Okay, and next we are going to Muscularis Externa. It is formed of smooth muscle layer, inner circular layer and outer longitudinal layer. and this outer longitudinal layer is thickened at 3 places to form 3 bands of Tenia Coli. Okay, understood? Next is Serosa or Adventitia. It is formed by connective tissue layer and it is partly covered by mesothelium or Serosa. Mesothelium means it is covered by the peritoneum, and in those areas where peritoneum is not present, we will say Adventitia. Okay, see, mesothelium is single layer of simple squamous epithelium. Okay, and in Adventitia only loose connective tissue is present, no epithelial tissue is present. Okay, and colon do not have plica circularis, the circular folds, the villi and the Pectinate cells. Okay. See here, like this it will look like under the low power microscope, and this is high power microscope. Okay. These are simple tubular glands embedding within the lamina propria, and epithelium is lined by simple columnar epithelium with the goblet cells. Okay. Here is the Muscularis mucosa. This is Submucosa muscle layer, inner circular, outer longitudinal layer. Okay, this is enlarged view of the mucosa only. These empty looking cells are the goblet cells. Okay, understood? So these points you write down for large intestine in your histology copy. You can take picture of this slide. Lining epithelium is tall columnar with lots of goblet cells, and lamina propria is filled with crypts of livercule, and Tenia Coli is present in the Muscularis Externa. So these are the features of the large intestine. Okay, understood? And you draw this diagram for large intestine. Simple columnar epithelium with the goblet cells. These are the sections of glands in the lamina propria. Here is the Muscularis mucosa, then Submucosa, then muscle layer, inner circular, outer longitudinal layer, and here the outer longitudinal layer is thickened to form the Tenia Coli. Okay. So here is the up to this mucosa, it is Submucosa, Muscularis Externa, and outermost covering is the Serosa or Adventitia. Okay, understood? Okay, so this is whole view of the large intestine. These are the epithelium lined by simple columnar epithelium with goblet cells. Lamina propria have sections of glands. This is Muscularis mucosa. Then here is the Submucosa. Some lymphatic nodules are present in the Submucosa. Some sections of glands or some sections of blood vessels, mainly arteriole and venular, present here. And these are the muscle layer, Muscularis Externa, inner circular, outer longitudinal, and longitudinal layer is thickened at this 3 level to form the Tenia Coli. Okay, understood? And outermost covering, this one is the Tunica Adventitia or Serosa. Okay. And this may be the mesentery of the gut. Mesentery is present for transverse colon, sigmoid colon, like this. Okay. Like this you will see, these are the goblet cells, columnar epithelium, lamina propria, you will see section of glands, some lymphatic nodules, some mucosa. Here is another lymphatic nodule. Tenia Coli have been shown here. Tenia Coli, inner circular, outer longitudinal, thickened to form the Tenia Coli. Rest epithelium and lamina propria, some mucosa. Some mucosa you can see sections of adipose tissues, okay, and blood vessels. This is enlarged view of the rectum, okay. Rectum and anal canal we will discuss. So this part is the rectum. Muscle layer, this is the Muscularis Externa, outermost Adventitia, Submucosa, epithelium, and Muscularis mucosa, lamina propria. Okay. Next we are going to vermiform appendix. This is very frequently given in spotter slide. Okay. Vermiform appendix, and also comes in your theory. Histology of vermiform appendix, or gross anatomy of appendix also comes in your theory. Okay, so appendix is a blind-ended tubular appendage extending from the cecum, and it is the narrowest part of the intestine. Histologically, appendix shows 4 layers of gut: mucosa, submucosa, muscularis externa, and serosa. And mucosa is lined by simple columnar epithelium with microvilli, goblet cells, and M cells. Lamina propria contains short tubular intestinal glands lined by simple columnar epithelium with goblet cells. Lamina propria is mostly occupied by large and small lymphatic follicles, and that even may cross the muscularis mucosa, extend into the submucosa. This is the identification point. Presence of numerous lymphatic follicles in the lamina propria that will extend into the submucosa. Okay, identification point for vermiform appendix. Muscularis mucosa is disrupted at many places by lymphatic follicles and that extend into the submucosa. Next is submucosa. It consists of the connective tissue. Many lymphatic follicles extend from lamina propria to the submucosa. Muscularis externa, it is formed by inner circular outer longitudinal muscle coat, and though the appendix is part of large intestine, it does not have any Tenia Coli. Okay, other 3 features are not present in the appendix. Appendices, Epiploicae, Haustrations, and Tenia Coli are absent in the appendix. Okay, main feature is presence of those multiple lymphoid follicles located in the lamina propria and extending up to the submucosa. Next, there will be serosa. Serosa is the outermost covering. So, appendix have a mucosa and other layers are the submucosa, lymphatic follicle extending from lamina propria, muscularis externa, serosa, and adventitium. Lining epithelium is simple columnar epithelium with numerous goblet cells, same as the large intestine. And lamina propria has simple tubular glands. Numerous lymphatic follicles are present that extend into the submucosa, and muscularis mucosa is formed by these 2 layers: submuscle layer, inner circular, outer longitudinal. Okay. See here, this is schematic diagram of the appendix. This is the lining epithelium, simple columnar epithelium with goblet cells. Lamina propria have this extension of these tubular intestinal glands, and these are the multiple follicles. Follicles are located in the lamina propria extending into the submucosa. And see, there is breaching of the muscularis mucosa. Muscularis mucosa is not continuous here, breaching due to presence of this lymphatic follicles which are entering into the submucosa. Okay, here is the submucosa. You can see sections of different blood vessels, adipose tissue, loose connective tissue. After that, inner circular, outer longitudinal muscle layer. No Tenia Coli is present, and outermost is the serosa. Here serosa, loose connective tissue, and some sections of blood vessels you will see. Okay, understood? So like this you will see under microscope. These are the epithelium lined by simple columnar epithelium, and these are the tubular glands. We have better slides, eta ekdomai baje slide. These are the lymphatic nodules, okay, located in the lamina propria. Here is the muscularis mucosa, submucosa. Here is muscle layer, muscularis externa, and outermost is the serosa. This is the lymphatic nodule, and these are the simple tubular intestinal glands. Okay. So these are the identification points of appendix. You write down these points. Okay. You can take picture of this. So lining epithelium is tall columnar with lots of goblet cells. Okay. And lamina propria is filled with lymphoid follicles and few crypts of liver cone, and no villi, no Tenia Coli. No villi will differentiate it from small intestine, and no Tenia Coli will differentiate it from large intestine. Okay, understood? And presence of lymphoid follicles are its own identification feature. So this diagram we draw for appendix. Lining epithelium, simple columnar epithelium with goblet cells. In the lamina propria, sections of glands you can see. These are the lymphoid follicles extending from lamina propria to submucosa. Muscularis mucosa, some muscle fibers are there. Submucosa, then muscularis externa, inner circular, outer longitudinal layer. Outermost is the serosa. Okay, understood? It has also a mesentery-like extension. Okay, it is covered by the peritoneum appendix. So like this you will see under the microscope. This whole view, whole section of the appendix. These are the epithelium. This is the lumen of the appendix, epithelium and lamina propria, sections of glands, lymphoid follicles extending into submucosa. Here is the submucosa, sections of blood vessels and these adipose tissue you can see. Then muscularis externa, inner circular, outer longitudinal layer, and outermost is the serosa. Serosa have sections of blood vessels and adipose tissue, connective tissue layer. Okay. Okay. Next we are going to anal canal. Okay. So anal canal is the terminal part of the intestine. Anal canal important for your theory. Okay. We are dividing the anal canal into 3 parts according to their lining epithelium and other different features. Okay. So anal canal length is 4 cm and its clinical aspect is hemorrhoids, internal and external piles. Those are very frequently given theory question. Okay, you have to know and also important for your final year surgery. You will see patients of hemorrhoids. Okay. So anal canal is the terminal part of the intestine. It is 4 cm in length and it shows 4 layers: mucosa, submucosa, muscularis externa and adventitia. Mucosa, the lining epithelium of anal canal, shows transition from simple columnar epithelium to stratified squamous epithelium. Upper 1/3 of anal canal is lined by simple columnar epithelium and middle 1/3 of anal canal lined by non-keratinized stratified squamous epithelium and lower 1/3 of anal canal below the pectinate line lined by keratinized stratified squamous epithelium. So first 1/3 simple columnar, next 1/3 is non-keratinized. This term is important, non-keratinized stratified squamous, and lowermost 1/3 is lined by mainly skin. Skin is keratinized stratified squamous epithelium. Okay. So mucous membrane of upper 1/3 shows 6 to 12 longitudinal folds called the anal columns. You will see sections of the rectum and anal canal. Viscera is there. Okay. It also shows a few short intestinal glands. At the junction of upper and middle third of anal canal, the anal columns fuse to form a transverse fold called anal valves along a line known as pectinate line. Okay, pectinate line is important because it is the watershed line at the level of the anal canal. Middle 1/3 of the anal canal has bluish appearance due to presence of deeper dense venous plexus. Okay, and the junction of middle and lower 1/3 is represented by a white line of filter. This line is also asked in your viva and MCQ. Above the anal valves there are depressions called the anal sinuses and apocrine sweat glands called, those are the anal glands, circumanal glands, they open into these sinuses. Okay, and when there is infection of these anal glands, there is formation of fistula. Okay. Next we are going to submucosa. Submucosa contains numerous venous plexuses called the hemorrhoidal plexuses or internal hemorrhoidal plexus above the pectinate line and external hemorrhoidal plexus below the pectinate line. That's how you differentiate internal piles and external piles according to the location of the pectinate line. Next we are going to Muscularis externa. Anal canal has inner circular and outer longitudinal smooth muscle fibers. Thick circular smooth muscle layer forms the internal anal sphincter, and outside the Muscularis externa a layer of skeletal muscle fiber is present, and these fibers form the external anal sphincter. Okay, understood? and outermost will be the adventitia. Okay, adventitia is the connective tissue covering, loose connective tissue covering. So this is the summarization. Let's see those features first. See, this 4 centimeter is the anal canal. This is upper 1/3, here is the middle 1/3, and this is third 1/3, lowermost 1/3. Upper 1/3 have these longitudinal elevations. These are anal columns. These anal columns are connected at the lower end by these valves. These are known as anal valves. Okay, and this line is known as pectinate line. Pectinate line means pectinate, it is coming from like comb. Okay, so pectinate line, and this is the watershed line here. Above the pectinate line there will be internal hemorrhoid, below the pectinate line external hemorrhoid. Okay, so we are enlarging this part. This is anal column, these are anal valve. So, and here is the anal sinus. In between the two columns there are some depressions, these are anal sinuses, and where the anal glands are opening. Okay, and if there is blockage of the opening of the anal glands, there will be chance of infection of the anal glands, there is formation of anal fistula. Okay, and this is second 1/3. It is lined by non-keratinized stratified squamous epithelium from this pectinate line up to this white line of Hilton. Okay, and this is bluish in color. Upper part is pinkish like the gut. Okay, this part is bluish because of presence of some mucosal venous plexus, and below this it is lined by the skin, keratinized stratified squamous epithelium. Okay, and the internal piles, bleeding from the internal piles is painless because it is supplied by autonomic nerves, and from the external piles bleeding is painful. Okay, because it is supplied by the somatic nerve. Somatic nerve means those nerves supplying the skin. Okay, and autonomic nerves were supplying the different viscera. So this is summarization of the anal canal. There is mucosa. Mucosa is divided into 3 parts. Upper 1/3 has simple columnar epithelium and short glands. Middle 1/3 is lined by non-keratinized stratified squamous epithelium. Lower 1/3 is lined by keratinized stratified squamous epithelium. Next there will be submucosa. It has hemorrhoidal venous plexus. Then there is Muscularis Externa. It is formed of thick circular smooth muscle fiber, internal anal sphincter, and external skeletal muscle fiber, external anal sphincter. And outermost covering is the adventitia. Okay, loose connection. Okay, these are some clinical aspects. Anal fistulas formed due to infection of anal glands, internal hemorrhoids, external hemorrhoids we have discussed, and adenocarcinoma of the colon. This is carcinoma of, it can occur at any region of the colon. Ulcerative colitis, ulcer formation occurs. Okay, typhoid fever causes ulcer formation in the large intestine, also in the small intestine. That's why during typhoid fever you are asked to eat only boiled food. Okay, no spices or nothing, oils, no oils should be taken for the healing of these ulcers, typhoid ulcers. Okay, celiac disease, this is also, you affect this large intestine. Okay, that's all. So you will see slides of large intestine and appendix. Okay, on the right side there is the lumen of the appendix. Okay, this is the lining epithelium lined by simple columnar epithelium with goblet cells. After that, lamina propria. In the lamina propria you can see a large lymphoid follicle, okay, which is extending from lamina propria to the submucosa. Some fibers of muscularis mucosa you can see. After that, if you remove the film, you will see the muscle layer, muscularis externa. Inner circular layer, outer longitudinal layer. Okay, and after that you will see serosa. এখানে muscularis externa layer অবধি কিছুটা দেখা যাচ্ছে। ওকে, ফিল্ড সরাবি না, আগে সবাইকে দেখতে দে, তারপরে ফিল্ড সরাবি। হ্যাঁ, ওগুলো সেকশনস অফ ওগুলো সেকশনস অফ গ্ল্যান্ডস, সিম্পল টিউবুলার গ্ল্যান্ড। ব্লুইসি তো আছে, এদিকে দেখ এইরকম ওভাল শেপের একটা লিম্ফয়েড ফলিকলস আছে। ইট ইজ ফর্মড বাই লিম্ফোসাইট and you will see the nucleus of lymphocyte. Nucleus of lymphocyte is stained with hematoxylin blue. Okay, that's why it looks blue. Lymphoid follicles, lining epithelium দেখ, তারপরে ল্যামিনা প্রোপ্রিয়াতে পুরো প্রমিনেন্ট লিম্ফয়েড ফলিকলস দেখা যাচ্ছে। হ্যাঁ, ডিসকস কন্টিনিউয়াস সাবমিউকোসা, মাসেল লেয়ারটাও এখানে ভেরি থিন। ওকে, অলমোস্ট দেখাই যাচ্ছে না, প্রায় একদম থিন আছে। তারপরে সেরোসা। ওকে, so if you will be given in exam, you can be given this slide. Okay, this is specific features of appendix. You see the specific features of the lining epithelium. Okay, lined by simple columnar epithelium with numerous goblet cells, numerous white dots. Every alternate cell is the goblet cell. Okay, you see, and middle white part is the lumen. So after that, in the lamina propria, there is embedding of the tubular glands, simple tubular glands. Also you will see some section, transverse section of the glands. After that, muscularis mucosa, then submucosa, and in the submucosa you can see some sections of vessels, adipose tissue like this, and after that there will be muscularis externa. Okay, after you see the epithelium, you can move the slide to see other layers. Okay, understood? Everyone first see this epithelium specific for large intestine, and then you can move the slide to see the other layers. Okay.